Iya ana aya hey.
It's inspiring, it really is. This really combines form and function. It's a beautiful building, it's in a beautiful location, and I think it's going to be a great healing center.
We're excited to see it open and for the residents to be able to start to utilize it.
So a very long journey. When I came in 1995, there was a rumor of a new facility being built on Haida Gwaii. So I've been involved for a decade, from the moving of the functional spaces, which is colored squares showing what departments interface with other departments, to physical design, structural design.
A state-of-the-art hospital. It will be very close to what you would find in larger communities.
Our staff right now work in quite confined spaces.
Just because of the space alone, we're not going to be falling over pieces of equipment that we have no place to store.
When I look at the new facility, it's integrating community services with the hospital into a health center model.
Will allow us to co-locate our physicians and community health programs along with our acute care services. Will really make a difference.
You can have quick corridor consults. You can talk to mental health about a client. You can quickly get people from the clinic into a hospital setting if they're sick.
We'll have a larger facility to potentially have more people being able to access services here instead of having to leave the island.
State-of-the-art healthcare services available on the island is extremely important to Northern Health.
How much better patients' experiences are going to be. Right now we've got a wonderful old building, but at least 2, if not 3 beds in a single room, very, very little privacy. Infection control is very challenging, but as far as the patient will experience, they'll all have individual rooms. They will have their own bathrooms. Our long-term care patients will be treated like gold. They will be looking out over Hecate Strait from a beautiful sunroom that's on the 2nd floor.
It is really awesome that they're going to have elevators that will help our elders for accessibility.
There's a palliative care room upstairs where it's like a personal suite. Family can come in, cook, go outside on a private patio and have their privacy.
And with our Haida community members, having room for large families to be in attendance for birth or death is very important. It's something we value here.
A pure hospital is virtually an industrial building, and that if you put an industrial building in a community like this, it wouldn't fit very well. So there's been accommodations made to the design of the facility.
When it comes to the hospital design and colors, we have the colors of our water, our land, and our forest, which are a big thing culturally for us.
The colors are meaningful too. They'll show where patients can queue up naturally to reduce signage. So the idea was to use color to assist with wayfinding.
The new facility is going to have a Haida name, sharing with an English name. The areas of the hospital will be named with Haida Immersion Language Program, and they will go and see what the areas feel like and come up with the names in Haida.
Having the additional space in the new hospital will allow us to really build on the existing community partnerships with First Nations Health Authority, with the healthcare services provided from Xaayda. We have a vision that this will be a real place where the community can come together and partner around developing a healthy community.
We really try to come from a perspective where we're all united on this island. So everybody is putting their own input into it, and we have to try to deliver a unique service here because we are so isolated.
We're so close to completion now that we're all excited to move to that space and be, like I say, under one envelope.
So on behalf of the residents in the area, we would like to say hawa.